Hi everyone, this is Knowledge Boost channel. Today's topic is about depression. In the coming minutes we will be covering all depression aspects. But first of all, let's see what depression is. Depression in psychology is a mood or emotional state that is marked by feelings of low self-worth or guilt and a reduced ability to enjoy life. Many of us have experienced this emotional state. What are the depression symptoms and what are the causes and what is the treatment? So let's jump into it. A person who is depressed usually experiences many of the following symptoms: feelings of sadness, hopelessness, or pessimism, lowered self-esteem and high self-depreciation, a decrease or loss of ability to take pleasure in ordinary activities, reduced energy and vitality, slowness of thoughts or action, undisturbed sleep or insomnia, and more sensitive toward small situations. Depression is probably the most common psychiatric complaint and has been described by physicians since before the time of ancient Greek. Physician Hippocrates, who called it melancholia, the course of the disorder is extremely variable from person to person. It may be mild or severe, acute or chronic, untreated. Depression may last an average of 4 months or longer. Depression is twice as prevalent in women than men. The typical age of onset is in the 20s, but it may occur at any age. Depression can have many causes. Unfavorable life events can increase person vulnerability to depression or trigger a depressive episode. Negative thoughts about oneself and the world are also important in producing and maintaining depressive symptoms. However, both psychological and biochemical mechanisms seem to be important causes. The chief biochemical cause appears to be the defective regulation of the release of one or more naturally occurring neurotransmitters in the brain, particularly norepinephrine and serotonin. Reduced quantities or reduced activity of these chemicals in the brain is thought to cause a depression mood in some sufferers. I want to get something clear here. Not any sense of sadness we feel we go and call it depression. There's a big difference between sadness and depression. Sadness is a regular feeling we all experience every now and then, but depression is something serious. Depression is also associated with disordered rapid eye movement sleep. A region of the brain known as the amygdala contains neurons that project into the brainstem and appear to be involved in modeling REM sleep. The amygdala is also associated with the processing negative thoughts and may be enlarged, hyperactive or otherwise dysfunctional in some depressed persons, although the significance of this association is yet to be defined. The link between depression and disordered REM sleep and abnormalities of the amygdala has led to new ways of research into the neurobiology and treatment of depression. Now let's see what really causes depression. Number 1. Physical, sexual, or emotional abuse can make you more vulnerable and sensitive to depression later in life. Number 2. Certain medication. Some drugs such as isotretinoin. This medication is used to treat acne, and other medications can increase your risk of depression. Number 3. Conflict. Depression in someone who has biological vulnerability to one may result from personal conflicts or disputes with family members or friends. Number 4. Gender. Women are about twice as likely as men to become depressed. No one's sure why. The hormonal changes that women go through at different times of their lives may play a role. Number 5. Genes. A family history of depression may increase the risk. It is thought that depression is a complex trait, meaning there are probably many different genes that each do small effects. The genetics of depression, like most psychiatric disorders, are not as simple or straightforward as in purely genetic diseases just like cystic fibrosis. Number 6. Major events. Even good events such as starting a new job, graduating, or getting married can lead to depression. So can moving or losing a job or income, getting divorced, or retiring. However, the syndrome of clinical depression is never just a normal response to stressful life events. Number 7. Serious illness. Sometimes depression happens along with a major illness or may be triggered by another medical condition. Now let's have a look about how is biology related to depression. Researchers have noticed differences in the brain of people who have clinical depression compared with those who don't. For instance, When comparing a depressed brain versus a normal brain, scientists have found some subtle but important differences, including gray matter abnormalities and the brain shrinkage and more active amygdala in depressed brain. And there's one more difference, which is a smaller hippocampus has fewer serotonin receptors. Serotonin is one of many brain chemicals known as neurotransmitters that allow communication across circuits that connect the brain regions involved in processing emotions. Scientists don't know why the hippocampus may be smaller in some people with depression. Some researchers have found that the stress hormone cortisol is produced in excess in depressed people. The treatment. Number 1. Psychotherapy treatment. Speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Number 2. Alternative therapy. Ask your healthcare provider about acupuncture or meditation. Some herbal supplements are also used to treat depression, like fish oil. Number 3. Exercise. Aim for 30 minutes of physical activity 3 to 5 days a week. Exercise can increase your body's production of endorphin, which could improve your mood. Number 4. Take care of yourself. You can also improve symptoms of depression by taking care of yourself. This includes getting plenty of sleep, eating a healthy diet, avoiding negative people, and participating in enjoyable activities. Sometimes depression doesn't respond to medication. Your healthcare provider may recommend other treatment options if your symptoms don't improve. So take care of yourself and try to talk to yourself and negotiate to see what are the reasons that are making you feel that way. If no improvement is noticed, I highly recommend you see a doctor. That's it for today, guys. I hope you find today's video is useful. If so, don't forget to like the video and subscribe to see more. Thank you.